Okay, so we're looking at another aspect of history taking, which is very important. This has to do with your observation. As you have communicated with the patient, as I have told you a lot of things, as you have done your physical examination and all, now what are the clues that could make you be able to identify risk? Okay, so you have communicated with a woman, either she's just a normal woman, no pregnancy, that's gynecology, or she's pregnant, that's obstetrics. You have communicated very well with this woman. She has told you a lot of things. So from what the things she has told you, what will now make you start to be suspecting that this woman, she's probably having some complications. So this is how to identify risk. Okay, so identifying risks is very important. Okay, because this is what will crown the whole procedure that you did. Will help you to know if this woman will have complications later. Will help you to know the kind of care you give to this woman. Will help you to improve maternal and fetal outcomes. So the process involves recognizing clinical red flags. Now we'll mention some of these red flags, right? And it will make you know them and always watch out for them when you are doing history taking. So the red flags you are trying to look out for, you are looking out for things like, has she given birth to babies and these babies were not matured? Has she ever had any miscarriage? Has she ever had any stillbirths? Where was she not able to give birth through the vagina, so they had to go for a cesarean section? Did she have any complications in pregnancy, like hypertensive issues, gestational diabetes issues, placenta abruption? Then for medical history, you are trying to see if the person has chronic illnesses, have any chronic illnesses. You can pause to look at them. Okay. Then for gynecological issues, you are looking at all those tumor growths and the rest of them. History of infertility. Has she ever had any pap smear tests and the tests are abnormal? Then for family history, you are trying to see if there's any disease condition that runs in the family, or has her mother had any issues when she was actively giving birth. Just any family issue. Is any first degree relative suffering from any obstetrics or gynecological issue? The social history, you are trying to look at the age of the mother. You are trying to look at if she smoke, take alcohol. Okay, will she have support for this pregnancy, or she won't have? Okay, so then general examination, you are looking for a high blood pressure. That's the vitals, right? You are looking out for obesities. You are looking out for if her blood levels are normal. Okay, then obstetric examination, this is when if the pregnancy has gone past week 20, you basically measure the symphysial fundal height. Okay, check out if the baby is lying properly, presenting with the head or not presenting with the head. Also check out if the movement of the baby is reduced or something. Okay, and also pelvic masses, cervical abnormalities, if there's any signs of infection or any discharge that is abnormal. Okay, so more risks to watch out for: if she has had preeclampsia, she has had diabetes, okay, she has had hypertension, if she's having a teenage pregnancy, there's advanced maternal age. Okay.